We do various kinds of body movements by using tendons, ligaments, muscles, and the bones to complete our daily activities. Some people work and train their bodies more than the others to make it stronger and better. Sometimes, if you work the body too much, there are injuries that can be caused. And it happens to most people who participate in sports and athletes. And that's why there are sport injuries. And today I'm going to focus only on injury called separated shoulder. What is separated shoulder? Separated shoulder is the injury at the ligament between the scapula, which is the shoulder blade, and the clavicle, which is the collarbone. It is also known as AC joint injury, acromioclavicular joint injury. This injury occurs at the ligament which joins the clavicle and the scapula together. Some people think that dislocated shoulder and the separated shoulder are the same, but they are not. Dislocated shoulder is the injury at the ligament between the humerus and the scapula, which is also known as glenohumeral ligament. This is not the injury of the tissues that joins the muscles and bones together, and that is why it is not tendon injury. It happens at the tissue which joins two bones together, and that is why it is the ligament injury. There are 6 grades of separated shoulder. Grade 1 AC sprain is the mild injury. There is no tearing of AC ligament, but there will be pain at the end of the clavicle and swelling if you have grade 1 AC injury. Grade 2 injury is the complete tearing of acromioclavicular ligament, and we can see bump on the shoulder if there is grade 2 injury. Grade 3 injury is the complete tearing of the coracoclavicular ligament and AC ligament. The clavicle will move in and out of its place if there is grade 3 injury. Grade 4 to 6, the injury are quite severe injury, and it involves not only the tearing of AC and coracoclavicular ligaments, but also the other ligaments that hold the shoulder joints together. Grade 1 to 3 injuries do not need surgery. Grade 1 injury is quite a mild one, so just the proper rest and the anti-inflammatory medicine can make it better. The healing time is usually 1 week. Grade 2 and 3 injuries need sling to prevent the shoulder from moving. If you move the shoulder when you have injury, it will make the injury worse. And the healing time is usually from 4 weeks to 6 weeks. Grade 4 to 6 injuries are quite severe, and that's why they need surgery and proper medical care. The healing time is up to 12 weeks. If you are not sure whether you have separated shoulder or not, you can test with cross-arm test. You have to bring your arm up to 90 degrees to touch the other shoulder, and you will feel pain at the acromioclavicular joint if you have separated shoulder. There are several things that can be done to treat the separated shoulder injury. It is good to put ice bags on the injury to reduce swelling and pain. It is also good to take anti-inflammatory medicine to stop swelling. AC joint taping is usually used in grade 2 and 3 injuries. The most important thing to do is not to use the injured hand. In severe injury cases like grade 4 to 6, the surgery called distal clavicle resection surgery is needed. Firstly, in this surgery, the small part at the clavicle and its cut, and the two bones, scapula and the clavicle, are fixed to their positions with the surgical staples. Then the patient needs to put a sling to prevent the shoulder from moving. This video is to give knowledge about separated shoulder injury, and again, if you got this injury, I would recommend you to go to physical therapist and follow his instructions. Thank you so much for watching, and see you next time.